Dear students, welcome back again in our new session. The session will be based on the topic Language Processing Disorder. It is known as LPD. So first we will discuss about the meaning of LPD. What is LPD? LPD stands for Language Processing Disorder. So basically, language processing disorder is a condition that affects the way the brain understands and uses a language. It is not a problem with intelligence or a motivation, but rather a difficulty with processing and using the language skills. For example, a student who is facing LPD problem might struggle to understand the complex sentences or follow the conversation even though they have a normal hearing and intelligence. They might have a trouble in identifying the main ideas of a story, understanding nuances like a tone and inference, or using the language to express their own thoughts and ideas. This can make a reading, writing, and communicating challenging. So basically, language processing disorder (LPD) is a neurological condition that affects an individual's ability to understand and produce the spoken language. It is a type of auditory processing disorder that specifically impacts the brain's ability to process the language. So after that, we are going to discuss about the key characteristics of language processing disorder. So we have mentioned here few key characteristics of language processing disorder. The first one is difficulty in understanding spoken language. So first one is struggling to comprehend the complex sentences. The student who is facing the problem of LPD generally struggle to comprehend the complex sentences. The second one is misunderstanding the words and phrase. The students, the person who is facing the LPD problem, generally misunderstanding the words or phrase, especially in a noisy environment. And the third one is difficulty following the multi-step direction. The next second one is challenge with expressive language. Under the challenges of expressive language, we have mentioned a few three key terms. The first one is difficulty to finding the right words to express thoughts. The person who is basically face the LPD problem will difficult finding the right words to express the thoughts. The second one is problems with grammar and sentence structures. The last one is limited vocab. Next one is issue with language memory. The students will face the problem regarding the language memory. If a person is facing the LPD problem, he will trouble the remembering what has been said. And the second one is he will face the difficulty in recalling the words or names also. The next one is problems with phonological processing. A person who is faced the difficulty who is faced the problem of LPD will face the difficulty in recognizing and manipulating the sounds in words. And the second one is he or she may be face the challenges with rhyming and breaking the words into syllables. And the last one is reading and writing difficulties. A person who is facing the LPD problem will face the reading and writing difficulties. So the first is struggle with decoding words while reading. The next one is problems with spelling and written expressions. After discussing about the key characteristics of LPD, now we are going to discuss about the impact of daily life. Individuals who is facing the LPD may face the significant challenges in various aspects of life, including education, social interaction, employment, and self-esteem. Let's discuss these main key terms in detail. So the first one is education. The students who is facing the LPD problem will face the difficulty in keeping up with classroom instructions, participating in discussion and completing the assignments. The next one is social interaction. He or she may face the problems and understanding and engaging in conversation and leading to potential social isolation. The third one is employment. He or she may face the challenges in understanding the verbal instructions which is given by the head authority and communicating effectively in a workplace. The next one is self-esteem, frustration and low confidence due to persistent language difficulties. Now next we are going to discuss about the diagnosis, how you will identify that a particular child is facing the LPD problem. So here are few techniques to identify to diagnose the problem. So diagnose the LPD involves a comprehensive evaluation by a team of professionals including speech language pathologist, conduct assessment to evaluate the language comprehension and production skills. The third one is audiologist, rule out the hearing loss and assess auditory processing abilities. And the third one is educational psychologist, evaluate the cognitive and academic skills to understand the broader impact of LPD. So after discussing about the main meaning and the key characteristics of LPD, let's discuss about the treatment. So treatment typically involves the individualized and targeted intervention such as a speech and language therapy, conduct a seminar, a workshop on the basic point of speech and language therapy focuses on improving the specific language skill such as a vocab, grammar, and sentence structure. The second one is educational support. Provide the educational support to the students who is facing the LPD problem, like accommodation and modification in the classroom to support the learning, such as a preferential setting, extra time for assignments, and use the visual aid also. The third one is auditory training programs. To conduct the auditory training program for the LPD, for the students who is facing the LPD problem, designed to improve the auditory processing skills such as recognizing and distinguish sounds. The next one is parental and teacher support. Training to help caregivers and educators to understand LPD and implement strategies to support the individual's communication needs. Here, next we are going to discuss about the strategies and supports. So here we have mentioned a few strategies. So first one is clear communication. Use a simple, clear and concise language. The next one is repeat or rephrase the instructions if required. The second one is visual aids. Utilize the visual supports like a chart, diagram, PowerPoint presentation and written instructions. The second one is encourage the note taking and the use of graphic organizers. The third one is assistive technology. Employ the speech to text software and other technologies to aid communication and learning. The fourth one is structured environment. To provide a structured environment to reduce the anxiety and confusion. So by understanding and addressing the unique challenges faced by the individuals regarding the LPD, language processing disorder, it is possible to help them and achieve their full potential and improve their quality of education. Thank you.